hi there. What's your name? Okay, that's perfect. Take a seat and make yourself comfortable there. Okay. Well, I'm Surgeon Sarah. Pleased to meet you. I'm just taking a little look through your notes, so just relax there a second while we see what we're doing for you today. Okay, so you've been referred back to me at this community ENT clinic. Okay, right, so you've had Grommet's ear tubes inserted a while ago and they've not fully come out on their own. Okay, that can happen sometimes. Alright, I can remove those, but I will need to give your ears an exam first just to make sure there's no infection or anything unusual going on there as well. Okay, so the grommets were put in 3 months ago. Okay, have they helped you? Good, but they're a little bit uncomfortable now. Yeah, I'm sure. Okay, so let me just see. Okay. Right. Let me get some gloves on and I'll take a little look at you. That's okay. Are you feeling otherwise well? Okay. Yes, it's great being able to do this clinic. I can help so many people without them going to hospital. It's more pleasant here, isn't it? Okay. Right then. I'll give your ears a little clean first on the outer part of the ear. Okay. I'm not saying they're dirty, just have to do it for hygiene purposes, the procedures. Okay, so I'll do your left ear first. Just keep nice and still, it might tickle a little bit. Okay, there we go. Just gently wipe that round there. Is that nice? Good. Just go from the top of the ear round, just behind the ear a little bit. Okay. Alright. There we go. How was that? Good. Okay. Let's get another one. There we go. They smell lush. There we go. Let's do your right ear now. Gentle. Right there. Okay. Just at the top and down to the bottom of the lobe there. Okay, that's perfect. Right. Let me just have a little feel around your neck, just check your lymph nodes there if I may. Okay. Right, just keep nice and still for me. Nothing feel tender, sore? Okay. That's fine, my lovely. Just going to go behind the ears. Okay. Right. Just underneath your chin. Okay. Just going to move your top just a little bit there, just across the collarbone. There we go. That all feels fine. Okay. I'll just do a temperature check. Alright. I'll just insert this into your ear. Okay, very gently. Keep nice and still for me. Thank you. Okay, so let's pop that in. Okay. Normal temperature, so that's good. Okay. I'm going to take a little look down your ears now. I'm going to use this, which is an otoscope. I'm sure you've seen one before if you come to the ear clinic. Okay, so I'll just gently pull up and back on the ear as I insert this. Alright, and have a little look around just so I know what we're working with. Okay, tell me if anything is uncomfortable. Okay. Here we go then. Gently insert that, just pull up and back. There we go, there. Wonderful. Okay, so I'm looking at your ear canal. I can see that grommet is almost out, but it's not quite. I can get that out for you, no problem. Your ear canal looks absolutely fine. It's not red and inflamed, so that's a good thing. Just reposition a little bit there now. Okay. Alright. Yeah, that looks fine. Right, I'll just remove this now. There we go. Well done. That wasn't uncomfortable. Okay, let's take a look at your right ear now. Okay then. So just pulling up and back and inserting the otoscope there. Okay. There we go. Again, the ear canal looks absolutely fine. I can see the grommet there. This one's a little bit more embedded, but I'll be able to remove that for you. Not a problem. Everything else looks perfectly normal. I just reposition just a tad there. Wonderful. Okay. That's all good. Right, I'll just remove. That's perfect. Turn that off for now. Okay. Right, jot a couple of little notes down. Does that feel okay? Wonderful. Have you been getting any pain in your eyes or nose or throat? I'll just take a little look up your nose if I may. Okay, I'm just going to gently push up on your nostrils just a little bit. Okay, a little bit uncomfortable for a second, but I'll be very quick. Alright, and I'll just be inserting this one more time. Okay, there we go, just pushing up there and in we go. You alright? Good. Oh, that looks fine. That looks fine, okay. And just to your left nostril, just insert. That's all good. So for me to be able to move these grommets, okay, I need to use microsuction, alright? And I will first numb your ears with some drops, okay? Numb the ear canal, eardrum, so you won't feel a thing. And then I'll be using this tool here, which is a microsuction tool. That'll insert into the ear, and the very gentle suction will just pull on the grommet, okay? And then I'll use some tweezers to pull out the grommet, okay? You won't feel a thing, I promise. Alright. Okay. Perfect. So I need to put some anaesthetic drops in your ears first. Okay. They might just tingle a little bit when they first go in, but then you should soon numb up. We've got those nicely mixed. Okay, and I'm going to get a little bit of tissue. Okay, there we go, just to catch any residue. Alright then, my love, you just keep still and I'll pop some of these in your ear. Alright, there we go. Tingling a little bit, it'll soon wear off. Okay. Alright. There we go. Let's pop it into this ear now. Okay, keep nice and still for me, thank you. Okay. You alright there? Perfect. So, I'll just give your ears a little massage, okay? That'll just help work that anaesthetic down. Alright. You might enjoy this part. Just gentle massage. There we go. Just helps get that working. Okay. It's nice, isn't it? Right, let's move to this side. Okay. Just work that in. Your ears may feel a little bit unusual, but that's normal now. They'll be numbing up lovely. Nice massage there. There we go. Perfect. Right, I'll just get what I need together and I'll be back with you shortly, so just relax there. Alright then, are you okay there? Perfect. Right, firstly, I just want to check that your ears are numb, so just keep yourself nice and still, and I'll just use these tweezers and tell me if you can feel anything, alright? Can't feel anything there. Right, that's perfect. Alright, try this side just to be sure. Never assume the other side is as numb as the other. Can you feel this? No? Okay. No? Okay. Wonderful. Right then. So now you're nice and numb. I'm going to be using this. Okay. It does have a light on it. And I can see right down your ear. Okay. You will hear some suction sounds and maybe a few little sort of crackly sounds as well. Okay. Just as I gently tease the grommet out of the eardrum. Alright? Don't worry, if anything does feel unpleasant, uncomfortable, which it shouldn't do, please just raise your hand, but keep your head very, very still. It's very important you keep your head very, very still because it's very, very delicate in there. Okay? Lovely. You ready? Okay. Right then. Just coming round. Okay. Right, going to gently insert the microsuction tool now. Okay, here we go. There we go. Just going to gently move that around. Is that okay for you? Away at that point. Alright then. Okay. Let's see if we can get it out now. There'll be a few little snipping sounds you can hear, but you shouldn't feel anything. Alright. Okay. You okay there? Wonderful. There we go. We got it. Oh, good. Okay, got it there. We'll pop that down there. Okay. Just going to have a check now with the otoscope, make sure it's all good down there. Okay. Just pulling up and back on the ear one more time. You're doing really well, my lovely. And inserting that otoscope. Okay. Ah, there we go. Just a tiny, tiny gap in the eardrum there where that grommet was. But that will heal in a few weeks. Okay, that looks wonderful. Okay. Alright, withdraw that now. There we go. Perfect. Okay. So, let's have a look at this side. This one was a little bit more embedded, wasn't it? But I'm sure we can soon get it out for you. Okay, keep nice and still again for me and raise your hand if something's not comfortable. Okay. There we go. I'm just going to insert that now. Okay, you'll hear some sounds. Right, you man of thing. let's just leave that there a second. Alright, you okay? Good. So I'm just going to have a little snip now and see if we can't get this grommet out. Okay. There we go. Oh, that's come out easier than I thought. That's wonderful. Gotcha. There we go. And there's the other grommet. So, check with the otoscope again now. Okay, just going to pull up and back. Insert that there. Okay, let's have a nice look. Wonderful. Again, just a little gap in the eardrum there, where that grommet was. Alright. They're all out now, so you should feel much more comfortable. You won't feel much at all at the moment because these will be numb for another hour or so, but it'll wear off. Okay. Perfect. Okay. You feeling okay? You're not dizzy or anything? No, that's wonderful. Okay, let's just check that. Okay. Right. Now I'm just going to pop some more drops down the ears, okay? These are just to keep the ear canal feeling quite comfortable as the anaesthetic wears off, okay? I won't get it into your eardrum, okay? They're just going to go on the very outside and I'll just work them in a little bit, okay? Yeah. It can get a little bit dry with the anaesthetic drops, so it's just to keep them a little bit comfortable. Yeah. You won't be able to feel them, but they would be quite cool if you could feel them. And really nice cooling sensation, these drops. There we go. I'll just pop a little bit on the outer part there, just by your ear canal, and I'll use a Q-tip and I'll just work a little bit inside. Okay. Perfect. Okay, just a little bit there. There we go. Wonderful. Just gently work that just a little bit there, just to make that a little bit more comfortable when the anaesthetic wears off. Stop it being dry and itchy. Okay. Ears are having a good pamper today, aren't they? And why not? Alrighty. Just do this one. Little drops on the outside there, just gently wipe that in there. Okay. And then I'm just going to give your ears a little wipe on the outside. There we go. Wonderful. Is that nice and comfy? Good. There we go. Right. So, Try not to get any water down them, okay, for a few days. Definitely don't go swimming. That's out of the question at the moment, okay? Don't put anything down your ears, nothing whatsoever, okay? If you feel anything unusual, obviously the anaesthetic will feel a little bit strange when it wears off. You might feel a little bit uncomfortable for the first few hours. I just advise that you take a mild painkiller, okay, like a paracetamol, okay, and rest for a few hours. You shouldn't feel any dizziness. If you do, just call us, okay? So that tiny little hole each side where the grommets were, that will heal in around 3 weeks, sometimes quicker, sometimes a little bit longer. All right. If you start to notice anything horrible coming out of your ears, as in, blood or a purulent discharge, like pus or anything unusual, please let me know. Okay, give us a call and we'll have you straight back. But that shouldn't happen. I'm not going to prescribe any antibiotics because there's no sign of infection there and you probably won't get any infection. Okay, but just try to not get anything down there for at least a few days. So if you have a shower, just try and cover your ears, or have a bath, and then obviously just try to avoid water going down for a few days. Okay, obviously no flying. Don't want you flying at the moment. All right, and then we will get you back in. If we don't need to see you before, which hopefully we don't, we'll get you back in for a checkup, okay, in about 4 weeks' time. Yeah? Okay. All right. Can you hear better? Do you think you can hear better now? Okay. Yeah. Okay. I'll just check one thing before you go. All right. Close your eyes for me. Which side can you hear my gloves? Okay. Which side now? And now. That's perfect. Yeah. You can hear that on both sides. Good. Okay. That's fine. Just wanted to make sure you could hear okay. I know you had a few problems with your hearing before we had the grommets put in, but yeah, it seems fine now. Any problems with your hearing, obviously, do come back and see us also. All right, so you'll go on your merry way. Enjoy the rest of your day. Have a nice relax, okay? But do call us if there's any problems. All right, you should find things are so much better now. Okay. All right, see you soon then.